Hello,
Hi, how are you?
good. Um, Thank you so much for having me and letting me asking you a few questions. My name is Wendy. I am a NP student at Youngstown State University,
Okay.
and I will be asking you a few questions. And okay, could you please tell me about yourself?
Nice to meet you, Wendy, and
Thank you.
congratulations on your journey to become a nurse practitioner.
Thank you very
We
much.
need more nurse practitioners out there due to the shortages and what's going on out there, but thank you.
Uh-huh.
My name is Kendra Adepetier, and I have been in the nursing field for about 20 years now.
Oh wow.
Um, I've been a nurse. I was a nurse. I started out on my nursing journey about 16 years ago. Then I decided that I wanted to further my education, so I decided to go back to school and be a family nurse practitioner. And I've enjoyed every moment of it, of
Good.
being a nurse and also advancing my education.
Very good.
Personally, I am I'm a self-starter. I like to be efficient in everything I do. I like to work independently, um, without being told to do things. What needs done, and that's how I look at things. I don't wait to be told to do things. I just go for it. In other words, most people have known me to be a go-getter because I'm actively trying to do things and trying to get things done.
Good.
Over the last 16 years, I worked in a variety of settings. I did long-term care, and I did um, subacute and acute care settings. So it's been a rewarding experience being a nurse because you're in people's lives to help them get better. You see the sick and you try to help them. So it's such a phenomenal field, and it's been such a rewarding journey for me as a whole. And I think this world would be a better place if we have more compassionate nurses like myself because I enjoy every moment of things I do, in caring for my patients.
Okay. And how long have you been a nurse practitioner?
It's been just about a year plus, pretty
Okay.
much. Yes.
Okay.
hmm
All right. Describe your APRN position,
Uh,
including your specialty.
okay. I've been fortunate to acquire a job shortly after I completed my education,
Mm-hmm.
and I work at a primary care clinic. And there we see patients 18 and up
Okay.
who, with different issues, medical problems. So it's been really rewarding because, like I said, I've been a nurse for 16 years. So this kind of like, I'm so used to the interaction I have with these patients. So they're all primary care clinic. I work in medicine, floors and telemetry. So they present with all kinds of problems. So it's a very unique specialty because you kind of like get to see everything and everything that comes through the door. So it's very nice to have to meet patients with different chronic backgrounds seeking help, and it's just a wonderful experience as a whole working in primary care because this is where the shortage is actually. Primary care shortage throughout the country is just growing each and every year. So it's such a great specialty to be able to meet people from different backgrounds and be able to listen to their problems and diagnose and treat.
Okay. And do you see an APRN influence in today healthcare system? Like, are you as an APRN influencing today healthcare system?
Absolutely. I mean, like I said,
If so, how?
The primary care shortage, as APRNs, we've been able to fill gaps because that's been a
Absolutely.
significant problem. The our patient loads, they're getting older and they're getting sicker, and we have shortage of nurses and providers as a
Mm-hmm.
whole. So definitely, I feel like as an advanced practice nurse practitioner, we are here to help fill the gap, to act as physician standards to help fill the gaps in rural communities, areas that we don't have providers in, and just to manage the shortage because it's an ongoing crisis that's not doesn't seem like it's going anywhere right now. So we need more advanced practice nurse practitioner, either way you look at it, to help in this growing complex healthcare industry. Definitely, it's been an issue over the years.
Mm-hmm.
Mm.
And I had some friends who are nurse practitioner who is moving toward the rural area. I don't know if you know anything about that. Um,
Definitely, because we have an overwhelming shortage of providers in the rural communities, and a lot of the patients that complain is we have to travel an hour, we have to travel 2 hours to the city to get treated. So we need more settings in its communities so that they're able to go there and seek care. There's no reason for a 80 something year old person to have to commute 2 hours to a clinic in the city and then have to go back again. That's so overwhelming. So we need more stations in rural communities to help with this shortage, to help our elderly clients because they're getting older and we don't have enough providers to care for them. So absolutely, we need this. We need help in our underserved areas and rural communities as a whole.
and what are some of the barriers that APR nurse faces today? Nurse practitioner faces today.
Um,
Advanced nurse practitioner.
some of the problems that I think we're facing as advanced practice nurse practitioners, number one, we would look at the full practice state um, right now. About maybe not even up to 50% are currently practicing full that have the full practice authority. We have states that are restricted, so we have to convince policymakers that these states can manage the magnitude of patients. They can be full practice as well. There's nothing limiting us as nurse practitioners to be full practice in the states. They have to understand the training that we bring to the table, the knowledge and the skills that we have to enable us, just like the other states have participated in coming to terms to bringing it to full practice. So we should not be restricted because there's so many problems that comes with that. We can't practice independently. There's a delay of care. The patients are complaining. So to provide quality health care, give us the opportunity to be able to practice, give us the full practice authority so that we are able to treat this patient because we are capable, we are trained, we have the fullest training and education. So I think we're ideal for this position. So there's no reason why some states should be restricted and other states aren't.
Yeah.
So definitely, and we've seen a lot of advanced practice nurse practitioner move to this full practice, which creates more shortages for the states that are restricted. So you have to balance it out and allow people, just make them full practice so that they can be able to feel competent enough that we can do this, we can get this care going, we can improve quality care, we can provide safe quality care for these patients that need the help the most. Another barrier that I think is, again, medical doctors believing that we don't have the fullest training like they do. We didn't go to medical school, we didn't get trained, and like they did their residency years and everything, but they need to understand that we also were trained. We've been nurses. We have that experience. We bring that knowledge base and experience to the table, and they just have to believe in us and know that we're competent enough to take care of these patients. And another thing is the patients believing in that they don't want to see nurse practitioner. Again, we have to educate the public that we are practicing to the fullest to our fullest knowledge, training, and education. So it's not like they just, it was just anybody trying to diagnose and treat you. We have the training, we've been given the training and proper education to practice. So these are all barriers, and hopefully they can be lifted up more and people will understand that we have the competence and we are, as nurse practitioners, confident enough to provide this quality, safe care that doctors are saying that we don't have.
Doctors and maybe NPs and
other providers.
physicians.
Yeah. Yes.
And what changes would you like to see made for advanced practice registered nurse?
There are a lot of changes, like allowing the public to believe in us, allowing other healthcare entities to not look down on us and think that we're not capable of treating patients. They have to come to understand that we are fully trained, like I mentioned earlier. We're fully educated, we're capable, we have the competence and knowledge, we're confident in what we do. And policymakers, they have to pass the laws where we are able to do more. There's some states that are restricted, and it shouldn't be that way. So we need policy makers to come together and make the decision to grant us full practice in all 50 states in the United States of America, and allow these patients to believe that we can do this as a whole, allowing our communities to believe in nurse practitioner and know that they are capable and can do this.
Yeah, I know we talked about that. You are in Pennsylvania and you are thinking about maybe if you could move to Washington, D.C. or Maryland because you would be more able to.
Right, exactly. Like we want to practice independently. We can collaborate with doctors, but we are fully competent to do this job. And we don't lack the education, we don't lack the knowledge. We bring a wealth of knowledge. So I think that people should be given the opportunity and let us see and bring that to light, instead of trying to demean the profession, saying nurse practitioners can't do it. We can. Just let it be.
All right. Miss Kendra, thank you so much for giving me your time. Thank you for going through this with me. I'm really, you made me really excited.
Yes.
I just want to get done and start.
Yeah.
Thank you so much for your time.
Okay. Good luck with your studies, and I wish you well.
Thank you. I appreciate it.
You're welcome.